Peace and greetings to you. This is Omar Abdul Malik, physician assistant and health educator, marathoner, and family man, and Muslim. We're about to acknowledge Ramadan tomorrow, God willing, inshallah. So I'm doing my Sunday run, and I want to field some questions. I got a question from somebody on Instagram from the United Kingdom, named Dominique, if I remember correctly, and she's a physician assistant student, if I remember correctly, and she was asking about losing your medical knowledge depending on what specialty you're going into. Thank you. Well, the fact of the matter is that when you go into specialties, you lose a lot of medical knowledge, especially the longer you're in that specialty. And I have taken notice that physician assistants are really falling into this category, just like our physician supervising physician counterparts. And it's kind of interesting. Now, I've been in the PA field for 20 years now. I count my time as a physician assistant student, which started in 1997. I graduated in 2000 and got my medical license in 2001. So I've been working happily ever since as a PA. Now I got a master's degree in infectious disease with a subspecialty in infectious disease from University of Nebraska PA program. Now the thing is, at one time I was doing exclusively ID medicine, and I worked with some really outstanding ID doctors. And then I also did a subspecialty in HIV medicine. So I really tried to push myself within the parameters of being a PA to be the best PA I could be in that field. But what happened is I lost a lot of the knowledge that I had garnered during PA school. And all I've done is work with adults for the past almost 20 years. So I can't really tell you about the Denver developmental scale for pediatrics or their vaccine schedules. My knowledge for things like, I don't know, maybe a lot of the HIV medications, because I don't see HIV patients anymore. I'm a hospitalist now. So the HIV patients that I do have already come with their medications. But there was a time I could tell you, about NNRTIs versus PIs. These are protease inhibitors and non-nucleoside transcriptase analogs and things of that nature. I could tell you about the mutagenicity of different drugs. Well, this one's got a K108 or M184. Yeah, I could talk all that stuff. But I haven't done it in years now. So I don't even know some of the new classes. There's new classes of medications that are out. There's new medications, there's new paradigms that are out. I used to give lectures on this stuff. I don't know it anymore. I kind of keep abreast of it because we have to take only two credits of HIV medicine to keep our licenses. We PAs and physicians in Washington D.C. anyway. But I can't rattle off information. I was pretty well noted in D.C. at one time for being able to disseminate this information. But I lost it. It's like running. You stop running. There was a time I was in really good shape because I was training. I mean, I thought that I could somehow get a spot on the Olympic marathon qualifiers. You had to run like a 2:20 If I can run a 4:20 marathon now, I'm doing well. But I haven't trained like that in years. Same thing for medicine. So I think Dominique told me she was trying to do orthopedics and some subspecialty of orthopedics. So you will lose the information that you garnered whilst in school. That's just the way it is. And that's okay, because your job as the subspecialist is to be that expert in that particular subspecialty. So if somebody does cardiology and you've got somebody who does pediatric cardiology, that's on a different level. If you have somebody who's maybe they're an oncologist, but they deal specifically with kidney cancer or something like that. I don't know if there's such a thing, but a nephrology oncologist. So you're an expert in a very, very small niche, which is not a bad thing, because you will be that one guy or gal upon whom your clinicians call when they're like, listen, we don't know how to treat this, we don't know what this is. And there's also a liability issue there. As this internist, this doctor with whom I used to work years ago, he was in his 80s. He said, listen, I've been an internal medicine doctor for almost 50 years. But, I can't, if something were to go awry with a patient who had cardiac issues, and that family wants to sue me, the first thing an attorney's going to ask me is, well, sir, are you a board-certified cardiologist? And you were treating this patient with this very serious cardiac condition? Yeah, I may be in trouble. So I really learned something there. I learned that, you got to kind of find your niche, as it were. Let's see, what else can I say about that? It's choosing your niche or your subspecialty is kind of like choosing whether or not you want to go into PA school or NP school or medical school. It's expected that you're going to spend a lot of time and effort really honing your knowledge base and your skill set in that field. I know a fellow physician assistant. All he does is diaphanous vein harvesting for people who are getting CABGs, so coronary arterial bypass grafts, and that he does that very, very well. But I don't know if he's able to do other things, and that's okay, because he's developed a name for himself. It's a question of motivation. What do you take to? I don't really like surgery at all. I have not scrubbed in on surgery since school. Back in my last surgery upon which I scrubbed in was 1999. I haven't done a single one since. You wanna walk? Okay. And that's okay. I have no desire to be good at surgery. I don't want the mask over my face and the hot lamp beaming down on me and the smell of burned flesh and blood wafting up through my nostrils and through the mask. I'm like, oh God, you gotta stand there for hours. Like, oh God, I gotta go to the bathroom. Hey, too bad we're in the midst of surgery. I don't want to do that. And I want my body to be intact, to be able to do things like this, go running with my kids, work out, especially as I age. I'm in my 50s now. There's things that take a toll on your body. Surgery is one of them. Doing hours and hours of surgery day after day is one of them. So that's why I chose not to do surgery. I like what I do now, hospital medicine. I could do that all day long, and I do. So, no, number one, yes, you will lose your general medical knowledge in other fields as you specialize and subspecialize and you develop yourself. as a subspecialist or specialist, that's okay. You'll have to take your PANRE or your board recertification exams, but that's when you go to conferences like John Belinsky. He has a good conference, CME for Life. And you just read the journals that we have and keep abreast. Have a general kind of light knowledge of what I would call a light knowledge of other specialties. I read some stuff about peds and OBGYN just to be able to know what a pediatric patient is, even though I have no intention of treating one. But and talk to your colleagues who are actually specialists. So I talk to the psychiatrists and the nephrologists and renal doctors. So I hope this answers your question. I wish you guys the best of success in your positive endeavors. Peace.